Hi, I'm Phil.
Hi, I'm Kate.
So today we're doing a video all about fungal toenails. So Kate, that's a problem we see a lot as podiatrists.
Yeah.
I know you've seen a few, and so have I, even this week. So now the most important thing that needs to be worked out is if you've got a funny looking toenail, the first thing we need to do is confirm that it actually has a fungal nail infection. So Kate, what is a fungal infection, if you give like a short rundown of what that is?
So it's when the fungal spores get under the nail and causes discoloration in the nail and makes the nail a bit funny coloured and
yeah, it doesn't look quite right.
No.
Often the nail will get really thick and crumbly. Yeah, and it's multicoloured. Most common colours like yellowy, brown.
Yeah.
So it's really important to realise if your toenail looks funny, it might not be a fungal nail infection, and I'd say probably a quarter of the people that come in thinking they have a fungal infection, they actually don't. It's just either a damaged nail or it can be due to like a systemic problem. So step number one, if you have a look here on our website, we've got a 3-step process we use. So the first thing is to make sure that it's a fungal infection. And we've got various tests we can either do in clinic or we can just clinically assess whether it's a fungal infection. We'll leave the next stage of it for a second, but if you have a fungal infection or if you think you have a fungal infection, you can get a test done by your GP, but that's also a test we can also order as well. So treating a fungal nail infection, I have to confess, I used to hate seeing fungal nails because number one, they are quite difficult to treat. So the treatment options that were around really didn't work well. So Kate, the most common one would be that I've seen people use, and even I've recommended in the past, is the paint on medication. So and you've had quite a few patients use that.
Definitely.
Would you say many people get a good result with that?
No, not at all. No. It's a bit of trial and error. Sometimes it works, sometimes it doesn't.
Yeah. The ones, what would you say the main reason is that it fails for the patients?
Probably compliance, not using it every day. And
well, it's something you have to do for usually 6 to 12 months for most people, so easy to forget. Yeah,
definitely.
What other reasons would you say that when people have tried this at home, painting a medication on, that it's failed? Any other reasons you've seen?
I guess if you paint it over and over again and don't file it back, and the treatment just can't get into the nail properly. Yeah,
that's such a good point. That some of these nails we see, they're very thick and deformed, and it can be quite a few millimeters, and it just doesn't penetrate. Okay, one of the other treatments that have been used in the past to treat, and still today are used, is oral medication. So it's a tablet you take that will try to clear out the fungus. There are some downsides to that. The side effects can be quite unpleasant for a lot of people. So, ranging from like a funny taste in the mouth, and nausea, that sort of thing. But also, it's really important, if you are going to take that medication, you need to have regular liver function tests, because it can be bad for your liver, which that turns a lot of people off. So obviously the punchline of this video is we have something else that we can use, and we've had this gadget for getting on to 2 years now. So that's our cold laser machine. So what this machine does is it's actually using a dual diode laser technology to zap the fungus and kill it. It really is as simple as that. The fungal tissue is really sensitive to the 2 wavelengths, and lasers are used a lot, in optometry, surgery. So they're not a weird thing these days. They're used a lot, and we really pride ourselves on bringing technologies that normally you have to travel, to a capital city to have, because we feel people who live here deserve to not have to travel a million miles. Yeah, exactly. So the Lunula Cold Laser is really cool. It's a great treatment option. As with any treatment, the effectiveness depends on whether you've picked the right patient. So, but if we can confirm, so if you look at this process here, we have to confirm that you've got a fungal infection. We do the laser treatments, and then we have the reviews to make sure that it's doing what it should do. But we're getting really good results for most of our patients with this one. So if we show some results here, now these are going to skip around. So this is just a carousel on our website. So this one here is pretty cool. So this sort of shows the progress from initial So the dates are here, so it's skipping around. But this one here is pretty straightforward. You can see the improvement over a period of, I think it's about 6 months. So the thing you got to keep in mind with toenails is they grow super slow. Yeah. So we're looking like from the base of the toenail to the end. This is a thumb, but the toenail, similar idea, is about 12 months. Yeah. So what the laser can do is kill the fungus, and then we want to prevent any regrowth so the nail can grow healthily without the fungus reoccurring. Okay, so that's the long and the short of it. The questions that people often ask is, does the treatment hurt? So Kate, does it hurt?
Not at all.
No? Do you feel anything?
No.
No. Some people feel like a very mild tingling, but most people don't feel anything at all. It's called cold laser because it's not a hot laser. So it should be called a not hot laser. That's probably the best way to describe it. It doesn't actually feel cold at all because it's not cold. It's just, it causes no increase in temperature. Now the way that it works, I've got a little animation here that I hopefully will work. So yeah, the laser, oh, is that working? I think so. We're very professional here with our videos. So here we go. So this is showing the laser penetrating into the nail. So it causes a chemical reaction in the nail to release oxygen through production of hydrogen peroxide. That's one of the lasers. The other laser helps to stimulate blood flow, angiogenesis to that area, because often a lot of these nails, they're fungal as well as damaged. Yeah. So, I mean, how many times have you seen patients who say they kicked their toe, they ripped it up, and then...
Every week, yeah.
Another cause of fungal infections too is people going to nail salons. So, have you seen that before?
Definitely, yeah.
So how would someone get a fungus in the nail from a nail salon?
Probably due to their infection control, maybe not having sterile instruments and cross-contamination between different people. Yeah.
It is an issue, and that's a bit of a side topic, but if you are getting your nails done somewhere, just ask, are your tools sterilized between treatments? Oh. Cool. So if you have any more questions, we've got heaps of details on our website of what the treatment's like, who it's for, all the rest of it, and a few other videos. So, but I think if anyone's at home suffering with a funny looking thickened nail, we're the guys to see, because as podiatrists, that's all we do all day is look at feet, and that includes toes. So, well, thank you for watching our video, and if you have any questions, you can always comment on the video or get in touch with us directly. All right, thanks for watching. Bye.